At this time, we'd like to get started. I would like to introduce someone who's going to give us greetings. And this is a friend of Healthy Start, the National Healthy Start Association. He's been with us throughout these conferences, and we're happy to have him this morning. Not only him, but he has a special guest with him. I'll let him introduce her. But Bill O'Donnell is the Associate Director of the United States Department of Health and Human Services, Center for Faith-Based and Neighborhood Partnerships. The Center for Faith-Based Partnership and Neighborhood Programs is the department's liaison to grassroots organizations. And the Partnership Center works in collaboration with all the HHS agencies, and their goal is really to extend its reach to impact HHS programs into communities throughout the country. So we're really happy to have him here with us this morning. So join me in welcoming Ben O'Donnell.
Okay, let's get started. Good morning.
Good morning.
You know, that was good. I almost feel bad asking you guys to do it again. You're all awake and ready and great to get at today. I am so glad to be with you. So glad to be representing the Department of Health and Human Services. Secretary Price was not able to make it this morning, but they asked for me to come and bring welcome and thanks for the amazing work that you are doing around the country, and especially the work you're doing to support fathers and families from around the country. I started this work almost 6 years ago. When I was at the White House on detail, and they said, Ben, we're going to do this fatherhood thing. Will you help us with it? And I started, and I did 2 conferences, and I guess we were just getting past the first trimester, and I went to Joshua Dubois at the White House, and I said, Joshua, Kristen, my wife, is pregnant. And Joshua was like, Ben, you're doing the fatherhood work, and you're going to become a father. Oh my gosh. And actually, it really was kind of like that. It's like, oh, I'm so excited. And so the product of that story is Nora Grace Odell, my little NGO, who's here with us today. And so it is great to have her with us. Yay! She will create an artistic coloring book product for you if you ask on request. So. But it is great to have her with me because she's been part of this 6-year journey that I've been on. And it's been a privilege to be on with many of you in that window of time where National Healthy Start has increased and strengthened its fatherhood engagement, especially through this conference. And so it's great to be with you all this morning. I want to talk about 3 things. I want to talk about some of the recent research that's really been compelling to me coming out of HHS, especially around fatherhood. I think it's really striking some of the things we're learning in this space, and I hope this research and my presentation on it will be helpful in strengthening to the work you're doing. I want to let you know what we know to the extent that we know anything about where some of the work in the administration is going to go, the conversations that we're having, and then just a good word about where we go from moving forward. So the recent research that I found really striking and I think is important to highlight is research around the social networks of men and fathers. And this is coming out of the Office of Planning, Research, and Evaluation. It came out just at the end of last year. One of the things it found was that the men that they looked at in these programs only had an average of 5 strong social connections. So men participating in fatherhood programs because they're struggling with their relationships, it sort of is intuitive that they would have fewer social connections. What's interesting is how many fewer they have. Average people in these programs have just 5. The average nationally for individuals is 23. So to think about that, to come into a program and only really have 5 people you can rely on, when on average, when you probably are thinking through how many people you rely on, you can get up to or around 23 individuals. But what does that mean for programs? What does that mean for how these guys are relating and connecting? I mean, one of the things that they're finding as well, which is that if a guy comes into a program and has fewer connections, he has a harder time with the program. And that's because he has a harder time with relationships. He hasn't had those modeled. In the study that they did, they used qualitative research to share some of the experiences and the stories of these men. They struggle to make these connections. And yet we struggle and ask why they're struggling in the program when it's all about connection. And so what we have to do is think through processes, strategies to help socialize men, to help them connect to other men, to help them connect to the program, but recognizing that this is an area that they have struggled with for over the life course that they've been in. They've struggled with this because they haven't had it modeled to them through relationships. They've actually had brokenness modeled in some cases. And so again, they haven't had these examples in their life that's going to help them not just be better fathers, but also even know how to relate to you in your program. And so what we have to do is think through strategies that socialize men. And I think that's an interesting concept in and of itself. And one of the interesting findings of the conclusion is that men are social. And so what we have to do is reframe and think about some of those things, and even do some reframing for the guys that we work with, I'm sure, because we have to help them see that they desire relationship, they desire connection, like we all do. And that comes in that form of social support. That comes in that form of connecting and relating. For fathers with fewer or no connections to family and friends, providing services in a group format may be provide needed peer support and connections. So recognizing, and this is something I've talked often with Rebecca, who was from Fatherhood Practitioner and Research Network yesterday, this idea that when we bring men together, we're creating this social environment. But what we have to do is think about facilitating and engaging dynamic environments like that, because if it's just presenting information, it won't connect with men. If it's just education, it won't connect with men. But if we're giving them and facilitating a safe space where they can relate to other men and connect with each other and in some ways connect with themselves, I think often we'll see more fathers participate, we'll have better outcomes, and not only that, but we will see that the impact sustained over time. That's also shown in the research that they did, which is that these people the men who have stronger connections, social connections, the impact is sustained over a longer period of time. And so that's one of the important areas that we have, and making sure that through our organizations we strengthen and connect to these men, help them see that these connections are important and valuable to the work that they do. I'm just off the top of my head thinking about another program where as a result of working with parents, they found that they could increase threefold the number of people who in an emergency situation that these individuals could call on. So think about that too, especially for a father who is parenting or in a parenting relationship, or someone who needs some of those supports. How many people can that individual call upon to support that ongoing growth and development that they have? And how can we increase that number for individuals? With that and with all of the work, the thought that I had is that we need to make a way for fathers and families. We have to make a pathway for them to participate. We have to make a pathway for them to grow and sustain that growth. And we need to do that and help them come alongside and find those journey partners with them. That's the journey we're on in the present administration. We still continue to bring on staff and have discussions about where things are going. One thing around parent engagement that's, I think, interesting to note is that one of the first events Secretary DeVos did at the Department of Education was a parenting event, which was talking about the importance of parents and getting them involved. Secretary Price has been very focused recently on the healthcare law and making sure that we're increasing awareness and trying to get changes made to that law that'll be more effective. But we continue to think through and build out strategies for where things are going in the future. One of the things I've heard already from the administration on multiple occasions is really the travesty and tragedy of our jails serving as treatment facilities for individuals, especially men, who are struggling with mental health. We know that this is, I know, and I think the administration knows as well, that this is something that we've got to think through and wrestle with, that this is not an acceptable place for how we work through and treat some of these challenges. And so there's ongoing conversations about some of the ways that different agencies can work together and some of the ways that we can work with partners to really think through especially serving men who struggle with mental illness. I've also seen an increased attention on effectiveness and efficiencies, and so the opportunity here is to highlight how Healthy Start and how working with fathers can bring about outcomes and programs that I know we're all looking for. We're looking for those strategies and programs that are going to make the most difference in the most places in the most ways, and I think we all can agree that fatherhood engagement is one of those places where we can show some of those outcomes. And ultimately, there's an attention and focus on supporting parents, strengthening families across the board, and really thinking through how we promote healthy relationships in a wide range of spectrums and programs so that we can see those outcomes that we're looking for. In general, there's interest and more attention on early childhood education and thinking through the ways that parents get involved in that space. And we continue to draw attention and celebrate that in a variety of ways and are already looking ahead towards Mother's Day and Father's Day as key moments that will come up soon that will give us an opportunity to really celebrate and look through some of those things. So, thinking through and thinking ahead. Last night, all of us as a family, my wife and the 4-year-old, who I decided not to bring with us because she'd be doing laps around the room. Nora is doing a good job sitting still, but right, Bria would be running around the room, right? She would be. We had an opportunity at this event that we had at our faith community where we got to wash our family's feet. And Nora washed Bria's feet very nicely. She poured the water. Bria washed Nora's feet and just kind of dumped the whole bucket on Nora. Nora said it was cold. And then I got to kind of dry both of their feet. It was this moment of service. It was this moment of joy and reflection and sharing my affection, sharing my appreciation for them as my daughters. And I think that's what we have an opportunity to do through our programs. We have an opportunity to serve children, to serve the future, to make a way for those kids where there might not be a way. We have an opportunity to clean feet. It's not always pretty. It's often not pretty. But it's good, and it's important. And it's a way we make a way for the children to come through and to be that future that we need them to be for all the different work ahead that we have, for the work that we have right now. Thank you so much for having me. It's great to be with you, and thank you for the work you're doing.